Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you back to episode 206 of Limb Lengthening Live, where the patients interview the guests. And today we have a special guest for you. We have Aaron back on the show. Welcome back, Aaron. How are you doing?
Feeling much better. Thank you.
Yeah, that's right, guys. And Aaron brought some x-rays. He's going to talk about his recovery. And what are we talking about in terms of his recovery? Well, if you don't know, Aaron was a bilateral femur lengthening patient. He got 7.4 centimeters on his femurs back in May of 2025. That's when his surgery was. He's fully recovered from that, but he also had to get Bowleg correction when he got his nails removed recently in the last month. So he's going to talk about that as well. So he brought some x-rays with him. So I'm going to share those. He's going to walk us through what he sees in each of the x-rays, and then we'll show another video that he brought with him, and then we'll start talking to the chat and answer some questions. Sound good? So here we go. Aaron, let me pull this up here. So this is your x-rays from June 29th, I believe, right?
Yeah, that's correct. And so yeah, this is the can't see if it's like left or right, but yeah, that's like the left lateral view of my the x-rays with the rod still in me. So you know, we do an x-ray just before rod removal just to confirm that, you know, all the bones and cortices have been solidified, so it's like safe to remove. And which Dr. Robbins confirmed perfectly well. So like on this one right here, I remember like the back side of my right femur, that was like the slowest side to heal. But it just took some time. I mean, you can kind of see it like over there, but it's already like solidified enough for the rod removal.
Yeah.
That particular section. Yep.
That's incredible. And then here you are bilaterally standing both legs. Look at this, guys. Look at the consolidation on that. It looks so crazy remodeled. I mean, you can see the bony callus of how it formed, and that consolidate is just so incredible. Wow. I mean,
yeah, the hypertrophy is pretty amazing to look at.
Yeah, robust. I had the same thing on my tibia, kind of bowed out a little bit like that, but it's reinforced. I know people say, is it as strong as the leg before you had the surgery? And I, like Dr. Robbins says, the thicker it is, to the fourth power. Dr. Bailey says to the fourth power, so it's probably stronger. So that's pretty incredible. Cool stuff, man. And then you brought some more x-rays. Let me share those. I had another screen.
It's also amazing to see, like, if you were to do like a before and after, like a pre-limb lengthening surgery, like x-ray, like you can see how curved and bowed my femurs were, but now it's like completely straight. But,
right.
Yeah. So absolutely. That was another advantage to the surgery. Yeah.
So here you go. You can see it without the rods. This is after rod removal. Now, when was your rod removal? What day was it?
That was June 30th. I think that was on a Tuesday, and I got my x-rays like that Monday, so June 29th.
Got it. Okay. Look at this bone, man. That's you can barely tell if it wasn't just like the little bit of hypertrophy here, the robust, bone here, you wouldn't be able to tell he had this. Okay, yeah, you can see the screw holes down here a little bit, but this was like one day after after the surgery, or like a week after, right?
Yeah, it was a week. It was about a week after-ish.
A week after. That looks incredible. He's fully consolidated. This guy healed like wildfire. Okay, so now looking distally to your tibias, this is where you have Bowleg correction. So this is what they did to help correct it. They made that cut here, the osteotomy, and then they fixed it up, right?
Yeah. And the left really has more of a correction than the right. The left was like 7 degrees of correction. I think Dr. Paley worked on that one, and then Dr. Robbins worked on the right. But you can see like they do a high cut just below the knee, and they wedge it to the point that it's aligned, and they put a plate, screws on it, and then they put like bone graft, and they gap. You can kind of see like the cloud if you zoom in a little bit on the right.
Yeah, let me
or the left leg. Yeah.
On the left leg.
See kind of that cloud. Yeah.
Let's see on this leg here. Oops.
See that cloud, like just a little bit above. Yeah.
Where's it? Right up here?
Yeah, a little bit out, but yes.
Oh, like right here.
Yeah. You see it. That cloud right there is the bone graft.
Okay.
The allograft, as they call it.
Yep. Got it. Interesting. And what is that exactly? What do they do?
They put bone graft in like where the gap is, just to help it consolidate faster.
Yeah, it was an allograft, so it was actually okay, got it. Not from your body, it was from something else, right?
Yeah.
Yeah, interesting. Wow, that's cool. So bony matrix to help heal it. Incredible stuff. All right, so then looking at your tibias a little bit closer from the lateral view, this is your left?
Yep, that's my left one.
left one, look at that. So this is the one that had more correction to be done. That's the bone graft right there. That's the tibial high bone osteotomy right there. Impeccable work. I mean, this is just, look at that, man. So now you have straight tibias. Is that right?
Yeah, and the funny thing is, like, Dr. Robbins was actually more. He sounded more excited than me when doing the for the outcome. But yeah, I now officially do have straight legs.
Look at that, man. That's incredible. So did you get any extra height from this?
People ask me that. It's very negligible. I would say like at most it's like maybe like 0.5 centimeters, but I'm pretty
Yeah.
much a solid 5'9" at this point. I didn't really do
Okay.
this for the height, but yeah, it's great.
Wow. And we're going to talk about your pain and we're going to go a little bit more in depth into that. But let's show the,
Yeah,
you have some more recent x-rays. So let me pull
yeah,
those
that
up.
was the one. That was the Friday before I left. So that was on July 24th.
Okay. Let me bring this one up here. Let me share screen for that one. Alrighty. Here we go. Here we go.
By the way,
July.
the July 8th X-ray, the one with like the full standing X-ray where you can see like my femurs and like the high tibia osteotomy, that one, it was so cool to look at. I actually set that as my wallpaper on my phone.
Did you really?
Yeah, it's so
That's so
nice.
cool.
But yeah,
Definitely. I mean, because
anyways,
it's
yeah.
a long time coming. I mean, recovery and then obviously getting your Bowleg correction. I mean, did you have Bowlegs your entire life?
So on the left one, yes, and the right one, when I drew a line from my hips like down, there really wasn't any that much bowing. But after I lengthened like a full like 7.4, 7.5 centimeters, I started to notice it got a little bit more bowed. So
Okay. Okay.
that was
Interesting.
interesting to see. I think that's why Dr. Robinson, like, he kind of like preferred, like, if he were to do some bow leg correction, like he prefers like the way how like I went through it is like after all the stature lengthening, the correction is done at the end. So
Because
yep.
that's true because more you can get it can become more pronounced. So why not fix it at the end and get it perfectly straight?
Yep.
Makes sense.
Hmm.
Okay. Wow. So this is just a
Yeah.
different view. This was a more recent one, right?
Yeah, so if you look at the July 24th, you can compare that to the back. So you can see on the my left leg or the right side of this picture, you can see it like actually closing in a little bit. Like there's a lot like less dark space. So I think
Yep.
that tells you that it is definitely consolidating there. On the right, I mean
It's
there's definitely
healing.
progress, but you can see, yeah, it is going, but you can definitely see like a very clear like fracture where the cut is. But yeah, I mean,
Yeah.
so one of the things like Dr. Robbins said in this appointment is that like what they're trying to look for is if the screws are backing out. And
Hmm.
if it wasn't at this point, it would show it, but it's not. So it's great. And by the way, like Dr. Robbins and Dr. Paley apparently had like two different protocols in terms of like weight bearing. Well, pretty much just like the same, but like the way how they worded is different. Like Dr. Paley was like, you can put as much weight as you want on it as long as you use like crutches. And then Dr. Robbins was like, I think that's crazy. You got to be like 50% like body weight as you're moving along. But I mean, they both said I can pretty much walk normally with crutches. But yeah,
With crutches and stuff. Yeah,
yeah,
I always found that between those two, like they always have a little bit of a different philosophy on their weight bearing. Dr. Robbins is very conservative. Dr. Paley's a little bit more foot on the gas. It's interesting, but it all works out. It's all about safety. But look at this. This is incredible, man. Straight legs. You also lengthened 3 inches, so now you got 3.5 inches of new height with straight tibias, man. So I guess the question now is like, would you get tibia lengthening done after these CLL? I'm just kidding.
no, I mean for real, this is a very good question because it's like if I definitely did consider like tibial lengthening, I would have obviously got it done by now. But I
Yeah,
mean, like I just don't have the opportunity to do it because I mean, like especially with like Dr. Robinson Paley's protocol is like you have to stay there throughout
yeah,
lengthening, and that's like a lot of downtime as well. Like just staying there for like 2 to 3 months, and not a lot of people have that opportunity. I don't currently at this time, but even
gotcha.
that, it's like I think I'm perfectly fine with where I am in
Yeah,
terms of like proportions and my height. So no
absolutely.
need.
You're taller than me. I mean, when you visited me, you were 5'9", so then now you're 5'9.5". That's so
Yeah.
cool. Very, very cool stuff. All right, and then you brought one more thing with you. I'm gonna share that. It's a video. So let me bring that up here. Here it is, right here. Share screen. All right, so let's play this. Let's see.
It felt amazing.
I love it. I love it, man. That's great. That is great. So when was that taken?
That was taken exactly 4 weeks, like from surgery. So that was July 28th, I think.
Okay.
Yeah, July
Okay.
28th.
So okay, so just literally like a couple days ago.
Yeah, like two days ago.
2 days ago. That's incredible. So you're
Yeah,
walking perfectly fine. You're off all
yeah.
assistive devices. Any pain?
Well, I mean, to go out and use the stairs, I still use crutches. But like, if it's like
Yeah.
in the vicinity of like my room, then I'll just like, and it's just like a few steps, and I don't think I'll use crutches for that. But
Yeah.
to go out longer distances, I'll definitely use crutches. For
Gotcha.
now.
Gotcha.
Yep.
Yeah. For stability. How long did they say you have to use crutches for stairs?
Well, I think overall it's like the consensus was like 6 weeks. I'm gonna have
Mm,
X-rays, another follow-up X-rays taken in like 3 weeks, and then hopefully I should be clear to be off crutches because I mean I feel great already, but man, like on that week I remember I'm gonna go to a conference. I have an in-person interview. Like I just got to be like mobile and walking, and that's another reason why I did this is just because like I only have enough time to recover for like about 6 weeks, and then after that I just got to get back to like my normal life. So this high
gotcha.
tibia osteotomy was a good logical choice for me.
Absolutely, man. I'm super happy for you. Long time coming, and yeah, I mean, you're healing like Wolverine. I mean, you're one of the
Yeah,
lucky
man,
ones
I
who.
was very I want to talk about that because like I was honestly very surprised with my recovery and like how great I felt after like 2, 3, or 4 weeks now, because like the first week, like week 0 after surgery, I was miserable, dude. It was like worse than femur lengthening, I would say. Like femur
Wow.
lengthening, like I woke up, I didn't feel any pain at all. But
Wow.
yeah,
From femur lengthening.
yeah, it was like zero pain, especially when I woke up at least. But like with tibias, like man, that the rod removal, the high tibia osteotomy, I heard all of that was like 5 hours, and I woke up and like I think a minute later I started feeling like a 6 or 7 out of 10 pain, and I had to like ask for like pain meds. They put something in my IV and that dropped it down to like a 1 out of 10. But you definitely feel a lot more in your tibias, and that first week, like trying to like put your legs out from the bed, not even standing, just putting your legs out, that was painful. Standing up, that was painful. Trying to move around, that was painful. Trying to like even like walk normally with crutches, that was painful as well. Like I couldn't even do that until like week 2. But the thing about this is like the recovery just skyrockets from there. Like it's not like femur lengthening. It's like it only gets better. So
That's incredible. That is incredible. That's interesting because I do agree that, like, I've had a broken femur, a broken tibia for different reasons. And I think that the tibia is just really sensitive to, pain. It's weird. I don't know why, but like, I mean, both are painful, right? And they can be, but you said you had less pain with the femur than the tibia. And I have heard of that from a lot of patients. So if you were to compare tibia lengthening surgery to femur lengthening, I think that tibia, more often than not, the patient might exhibit a little bit more pain, but it's obviously very variable.
yeah, it's a sharper pain. I mean, you definitely feel in the osteotomy, but I think after a few weeks, like it definitely gets better. And obviously,
Hmm.
there's some people that say different things. I actually met a patient who just kind of came back for tibial lengthening. He told me that tibial lengthening or the tibia surgery felt a lot like it felt easier a bit than femur. So I mean, people say different things, but I know like I think if I were to do tibias, I can expect some like sharper bone pain like when I wake up, and most people say that as well. So
Yeah,
I'm glad I'm over that hill.
that's how it was for me. I remember when I first broke it, and then when I got lengthening, it was very stark. Femur, when I broke it, I mean, it hurt when I moved and stuff, but yeah, it's crazy. But everybody's different. But yeah, man, that's awesome. Well, thank you so much for sharing all that, Aaron. Okay, so we're gonna go into the live chat, and then we'll loop back to Aaron and talk. You guys have any questions for Aaron about his femur lengthening surgery, his tibial Bowleg correction? Now's the time to ask. But we're going to go ahead and answer some of your questions here in the chat. So let me just go ahead and hide the video. And let's go through here. So let's see what's going on. All right, we got Ben in the chat. Yay. All right. So Pablo Klaus is saying, hey, Victor, I saw your Discord message where you said that Johannes underwent tibia lengthening. Are you able to disclose which surgeon he went to? Yeah, I mean, he went to the Dr. Becker in Germany. But yeah, we're going to plan a podcast sometime in mid-August or so. We're going to record it then. obviously I still have another podcast I gotta get out. It's just, hard sometimes because I want to do a good job on the podcast. So so Johannes and I are talking about planning for a podcast about his tibial lengthening, and he has some things to share with you of why he went for it after his 10 centimeter femur lengthening with the Betz bone. And he's talking about biomechanics and proportions and all this, and I think it's really insightful. So we're going to bring him on. It might not be a live stream because he's in Germany, but it'll be at least the podcast you guys can enjoy. All right, Beast Incarnate. I like that. That's like a Brock Lesnar talk. MMA fighters and shin conditioning to kick harder. Is limb lengthening going to affect that? Let's throw this over to Aaron. Aaron, what do you think?
I'm not an MMA fighter by any means, so I would have no idea. But I guess let's see, which shin conditioning to kick hard. We did have an MMA. I remember there was a limb lengthener who I think he did MMA fighting. I think you might know someone, but let's see. Okay. If you're talking about are you talking about femur or limb lengthening, or the tibia lengthening? That might be. I don't know.
I think it's for tibia. So I personally think if you were to ask me, because I had tibia lengthening, it's healed, right? After about 2 years, that thing is hard bone. It's consolidated, compact bone. If you took my tibia out of my leg and whacked somebody with it, it's not breaking. It's breaking their head. It's breaking their head, right? So, you can definitely get back to shin conditioning after full ossification of the bone, after it's compact, consolidated, hard bone. Now, when you're able to weight bear after lengthening, it's not fully compact, right? You have enough cortices to stabilize you vertically up and down, but you don't have enough to go do shin conditioning. That's going to take longer. I think most surgeons have said on here on this podcast that you need up to 2 years, and that's what I think you need to get to that level of bone consolidation. Aaron's bones look like they're there, but I think that he would need some more bone density before he could do stuff like this. So that's my thought. We'd have to ask a surgeon to be for sure. But all right, Aaron, this one from Two to the Top. He's saying, was this covered by insurance, the tibial Bowleg correction?
Yeah, if you go to their website, there's actually a very specific price tag that they show for if you want to get your Bowlegs corrected with the femur lengthening, it's $50,000, which is expensive. Wow. But if you were to get it with the tibial lengthening, I think it's cheaper. It's maybe $10,000-ish $1,000, because and that makes sense because it's within the tibia. But no, typically it's not. But you can double check and try it on your own if that works for you. Then all power to you. But typically no.
Yeah. And I know that it depends.
Unless it's very severe, then maybe, but yeah.
But I think there's certain medical thresholds that certain insurances will cover it. If you have a certain amount of rotation or deformity, that it just depends on where the threshold is. Nicodins is saying, I'm saving up for Dr. Pilly. I have about 10 grand saved. If I use care credit to help, how much would you recommend someone have saved specifically for femur only lengthening? Great question, Nick Dens. I would say that at least 50%. Okay, so I know a lot of patients who have used this strategy and this route before, and some have done it all with a loan, but then they have to pay back heavy amounts, and then some have done a quarter. But I find that the vast majority of patients that do this, it's 50-50. They save up 50%, and then they get the loan for 50%. And it's just much more feasible to pay it back and get the procedure done in a timely fashion. So insurance won't cover it. Okay. Yeah. Okay. Gotcha. Alex Smith is saying, is it possible with the new Precise Max nail to get 3 to 4 centimeters on the femurs and 2 to 3 centimeters on the, 3 to 4 inches on the femurs and 2 to 3 inches on the tibia, and surgeries 3 weeks apart? Is there anyone that has gotten quadrilateral lengthening yet with a new nail? Great question. So the nail just launched 2 weeks ago.
2 weeks ago.
Yeah. So I know one guy who's getting it done quadrilaterally, but he's not getting his second surgery until next week, because it just launched 2 weeks ago and you need 3 weeks apart, right? So his second surgery is coming up next week. So there is one person that I know who I've consulted with. So he is getting that. But I'm sure there's more, but I'm just saying that it just launched, right? So yeah, but let's see. Your question is it possible to get 3 to 4 on the That's
Well,
a good question.
the new nail still only goes up to 8 centimeters, just like the old precise
You can't
nail.
do 4, right? You can do 3, but here's the thing. I'm guessing you're asking with the simultaneous approach, where you do them both at the same time. And Dr. Robbins was on the other day, and him and Dr. Bailey said that it's very hard to get more than 10 centimeters or 4 inches amongst the two limb segments, just because you're stretching the nerves and the soft tissue. The bone is never the problem, but it's the soft tissue. But I don't know. I think the weight bearing will help, but they kind of left it up in the air, right? Because they don't really know. So as patients start to walk a lot more, you might be surprised that some patients can do more. And they're just looking for any medical reason that they have to stop you. If they can't say, hey, your knee is locked up in a contracted state or your ankle is locked up, then they won't stop you, so you can keep going. So some patients might be able to get more, but yeah.
Yeah, there was someone like who went up to like 11 or 12 centimeters, and she was a quadrilateral patient too. So I mean, it is possible as long as you like pass all your flexibility tests and whatnot. So
yeah, absolutely. I think the PMAX will make it more likely, but we'll just have to wait and see. So PMAX part 3 will be coming out. I actually, when we got off the stream the other day with Dr. Paley, he said he'll come back on to update us on his patients, how they're doing, like probably in like 6 to 8 weeks or whatever. But Sodar from 94, after limb lengthening, did you have to throw out your old pants? Aaron, what did you have to do?
absolutely not. I'm actually was very impressed because now all of my shorts and like most of my shorts and now all my long pants, they fit me much better. So that was a blessing. That was a huge blessing. I thought I would have to get new pants too, but I guess not. Like they were just baggy in the beginning. So I'm really happy about that.
Yeah, absolutely. No, that's crazy. Yo, it's your bro is saying, Aaron, what made you want to do limb lengthening and what were your wingspan and sitting height?
Yeah, it's interesting. I also got this question because I got interviewed from People's Magazine like a week or two out from my surgery, and they asked the same thing too. They're making the video, I'm sure, as we speak. But anyways, I started going out a lot more to like public spaces like conferences, what do you call it, like church, social meetings, organization meetings, and like the more I got exposed out in public, the more I started recognizing that, wow, I'm actually like shorter than average. And that's actually started like weighing on my mind. And I think that's why, like for me, like once I discovered about limb lengthening, I immediately just kind of like jumped on it and haven't looked back ever since. And that's like one of the best decisions I ever made. Wingspan, I don't know about my sitting height, but my wingspan was 167 centimeters. So right now I'm 175, 176. So that's like, what is that, like 8 or 9 centimeters?
I'm gonna see if I can look at your wingspan here when you're walking. You have your hands in your pocket. Let's see when you're walking back.
But also like the shirt's kind of covering my
it is your waistline
a little bit. So
yeah,
I remember like I did do, there was a video of me where I walked back like last year and I tucked in my shirt on purpose just so you guys can see where my torso was, but you can refer back to that. But hey, I'm perfectly fine with my wingspan. I'm not looking to do humerus lengthening or whatnot. I think I'm perfectly fine the way I am right now. So I
agree. Your proportions look great in clothes and stuff. So I think honestly, yeah, I'll try to find that picture. I think you probably have in your content sometime and share it. All right, moving right along here. Hitcham Masarai is saying, during distraction phase, how many hours did you dedicate to physical therapy per day, Aaron?
Yeah, I would say like on average 2 to 3 hours. A lot of that I started transitioning a lot more to like pull time. So like in the beginning, I would probably have like 2 to 3 hours of like on land like therapy, just like hamstring stretches, Thomas stretches. But then after around like July, like midway of my limb lengthening, I started after my 1 hour of like physical therapy at Paley. I went back, I lengthened, I would take a nap, and then I would like do another lengthening, and then I went into the pool for like 2 to 3 hours, and then after I finished, I did another lengthening, and that was pretty much my main physical therapy there.
Okay, so the pool really helped you out a lot.
Oh, it did, and like a lot of people right now has been taking like at least at Homewood Suite, they're taking a lot of inspiration from that. So I know one patient in particular, he's trying to like peer pressure everyone to like join in the pool with him. If he's watching this right now, he knows who he is. But yeah.
Oh, really? So he specifically followed your tip to use the pool?
Yeah. In fact, like there was another guy he like last year did the same thing too, and he started going in the pool like man, like it didn't matter if it was like daytime or nighttime, or if it was like raining or not. Like he would just like spend so many hours in the pool. Like it was crazy. But
That's
yeah,
crazy.
I kind of started it, but everyone's just kind of like, there's a few people that are running along with that, and I think it's helped them a lot. So
Yeah, I think pool
that really was
therapy.
the cheat code.
It's the cheat code, man. You can hack the lengthening recovery. I mean, that's why your bones heal there. Everybody's gonna jump in,
Yeah,
dive in the pool.
yeah,
All
especially
right.
with like, yeah, especially because I didn't have the PMAX. I mean, you're pretty much full weight bearing.
Mm.
You feel like completely like normal in the pool. If it wasn't for any other stuff like bone callus, extra bone callus or whatnot. But yeah, highly
That's so
recommend it.
true. Yep, absolutely. I think every patient, once your incisions heal, get in that pool, if it's warm enough outside. All right. Pablo Claus is saying, do you have any experience with MK677? I'm thinking about using it during the process, mainly to increase my appetite, so it's easier to get calories in, protein in, plus improve sleep and GH levels. Great question. So MK677, from what I remember, it's a peptide that helps with like ghrelin release, which is your hunger hormone. Leptin is the satiety hormone, and the other side of the yin and yang is leptin and ghrelin. But yeah, I think that it can help with hunger and increasing your calories. If you're not hungry now, how much are you eating? Um, I wouldn't use it right away because it also has I think it helps with like insulin release and yeah, GH levels, because ghrelin, when you're hungry, yeah, it helps the release of pituitary growth hormone. I don't remember the whole process, but I would say talk to your doctor, obviously, first and foremost, but I don't think you would want to use it right away because you might be surprised. Aaron wasn't eating a whole tremendous amount of food and he was healing really well, right, Aaron?
Yeah, I mean, I only ate like one or two meals a day, and that was it.
Okay.
But no, I did not take any sort of external things to help me with my appetite at all. Just yeah.
Mm. Yeah. So, I mean, this is a great idea, but what I recommend is wait till you see how your bone healing is progressing before you take anything, because you might not need it. If you're healing really, really well and you find that like from the sheer metabolic stress of the surgery and like the lengthening process, you naturally want to eat more, then why would you have to take it anyway? So it's a great, I call it contingency plan or a backup plan, but probably not right away. Don't just like have it in your cabinet like, I'm going to start taking some MK677. And obviously talk to your surgeon, make sure that it's okay to take. They probably don't know what it is because it's like a newer thing. Peptides, GLPs, they're all really new, so a lot of people don't even know what they are. I just heard them on podcasts and stuff. I got to dabble deeper. So anyway, awesome. Will you be interviewing him soon? I think you're talking about Johannes. Yeah. So probably sometime in mid-August or third week of August. We were going to do it like in late June or early July, but he had something come up, so we had to reschedule. All right, Aaron. This is from Invincible Summer. Hey, Aaron, the hardware used to be for your Bowleg. Is that removable in the future, or do you have to live with it lifelong?
Yeah. So when Dr. Robbins told me like after surgery that they used titanium instead of like stainless steel. In the past, stainless steel would like rub on the patients and they would feel it. They want to take it out, but he told me like titanium was like very low profile and like more biocompatible. He said
Mhm.
that he would be surprised if I said that I feel it. And so it can stick. He approved like it can stick with me for life if I really want to. As far as like, so if I were to take it out at the moment, I don't really feel it. I'll have to see like once I'm able to like run and do like intensive sports again, I'm gonna try and see if I still feel it. But if not, then I can keep it in with I can keep it in with me like forever. So it doesn't
Yeah.
really matter. But time will tell.
Yeah, that's true. I don't think it's a bad thing to kind of keep it in. I know my dog, probably like 4 or 5 years ago, he had to get like a high, they call it a TPLO surgery, like a tibial plateau leveling off surgery, like basically a leveling osteotomy, where it's kind of like what you had done, a correction of the tibial plateau. And the surgeon asked me, did I want to go back in and take it out? I was like, no, the dog hates surgery. I was like, leave it in. And now he's running 3-4 miles a day with me in the morning. So I'm like, it's probably the best thing to keep it in. It stabilizes your legs. All right.
Yeah.
Why is it okay? Here we go. Hi 4550. Why is it so bad to get 10 centimeters on femur only? Oh, okay. Aaron, you want to answer this?
I saw a guy who did like 11.7 centimeters on his femurs, and this is a guy who broke the live life taller record. And he came back, and he obviously wanted to do his tibias to like balance out his proportions. But he kind of said on that, I remember that I'm in the middle of watching that video, but he said like if he were to go back in time, he would have split the proportions like doing quadrilateral. So I think the main thing is just like from an aesthetic perspective, I mean, it just looks off if your femur is like way too damn long.
Yeah.
It
No, you're
obviously
talking
affects your biomechanics too, but yeah.
Yeah, you're talking about the Michael Melman.
No, not him. He
Oh.
did like double quad like two times
double quad,
over.
yeah.
I'm talking about this guy. His name is Damien. But
okay.
yeah, I think it's a recent video on their channel, but you guys can look it up. He's like a Polish guy, but
Got
yeah,
it.
I mean, he broke the record for femur lengthening on their clinic. So that's
How much did he do?
It's like 11.6 or 7 on his femurs.
Wow. Yeah. I mean, there have been some Betts patients that have done that with the Betts nail in the past. They've done 11 centimeters. And I remember one guy doing 11 centimeters just on his femurs. I was like, man, that's going to throw off biomechanics, like you said, quite a bit.
Yeah. I wouldn't even like that. I mean, like, dude, even like when I was like showering, I remember I got to like 4 to 5 centimeters and I started noticing my femurs were looking like a little bit unnaturally long already.
Yeah. Yeah.
But so, I mean, you double that, man. It's just, I mean, you can visualize it yourself. How it would
absolutely. Look. I know. That's personally like for me as a bodybuilder, symmetry and stuff. I think like 6.5 centimeters in the femurs is like the most I would go. But I naturally have longer tibias now because of the tibia. Precise Max, 5 centimeters on their tibias, then come back a year or more later for another surgery to gain the remaining 3 centimeters. How difficult? So that's been done before, especially for the quadrilateral approach by several patients. I have talked to quite a few patients who have done that, and they say it's easier the second time around. So
I guess my question for this one is like, why would you not want to like get those like 4 or 5 centimeters on your femurs? I mean, this guy's talking about like a re-break, and he's just mentioning like the tibias only. I mean, 8 centimeters on tibias. I mean, that's just. I guess.
Assuming like there is another scenario that maybe he already has femurs, but if it's just pure tibias, yeah, that's quite a bit of lengthening. 8 centimeters on the tibias. You start to look a little odd, I guess, maybe. But I don't. It could distort your biomechanics unless you're naturally long on the femur to begin with. All right. Back to Hiche. He's saying, how would you recommend preparing for surgery? What type of stretching exercises? So they were on the other day. Dr. Robbins is like, oh, it's helpful for the routine and getting into the routine. I still believe it does help with flexibility and, loosening up the joints and the hip. I think flexibility beforehand does help. I think stretching does help. There's research that shows you can become more flexible if you keep at it and maintain it. The debate is ongoing. But anyway, I do feel like if you're tight and stiff behind the knee, if you're getting femur lengthening, and at the hips, you should definitely be doing hamstring stretches and hip flexor stretches. And then if you're doing the tibia, you should be definitely doing calf stretches, but with your knee straight, and then also with the knee bent to get the gastroc and the soleus. Those are the big 4. Obviously, there's one more. I'm sorry I missed it. It's the side of your upper hip, the abductor, because if you don't get that, a lot of times you'll get like that TFL will pull on the IT band. You'll get more of a wide leg effect. So definitely do the pigeon stretch is what I highly recommend. An elevated pigeon stretch on a bench or a couch at home, it's priceless.
Yeah, I mean, like a lot of patients complain their hamstrings were starting to get tight as well. I think stretching that beforehand will definitely help. There's also some patients who got like the proximal IT band release, and they're saying like that really hurts them. And I remember there was one guy, my surgery twin Aiden, shout out to him. He was gonna get it, but then like after a year of preparation, he stretched his way out of that. So yeah, I think that pre-stretching definitely helps. I'll admit I didn't really do that much stretching. There was like 2 main things I can think of. The one was hamstring, but I think the only thing I did was like I just try to like touch my heels to my butt, and I just like hold that position for like 1 or 2 minutes, and I did it like the same thing for the other leg, and I just repeated that like every once in a while. But getting familiar with the hamstring stretch, Thomas stretches, everything that you're going to be doing while you're lengthening will definitely help you out.
Absolutely. And I agree with you 100%. I think pre-surgery stretching has more benefit than a lot of surgeons let on. Maybe they don't know, but physical therapists believe in it, so that's what matters. Alex Smith, if I get the surgery next month, I'm planning on stretching an hour or two today, 2 hours every day, plus BPC 157 and TB 500, and maybe stem cells. And if everything goes well, I'd like to get 12 centimeters. I'm 5'10" at the moment. Great plan. I think that you have a really good plan there. Keep those peptides in the cabinet. Like I said, give it like a few weeks, get outside the surgery phase, make sure your body comes back down to baseline, and then give it another 2 to 3 weeks, which is, like I said, 4 to 6 weeks after, before you implement anything, because you might be healing extremely well. You might not even need anything, because if you start taking that and you heal even better, I mean, who knows if it does do rapid consolidation, you pre-consolidate. So I would just say, just monitor by the x-rays with the surgeon, and then if things look really on track, don't do anything. But if it's like, okay, you're a little bit behind schedule, then talk to them about what you can do. But you like to get 12 centimeters, I guess, quadrilaterally at the same time. That's a good push. You might be lucky and be able to get that. So David Goggins. Yeah. All right. This one's
I know he's not referring to me.
I guess he is, man. You're the champion on here. Hi, Aaron. Did your nerve pain completely get resolved permanently? I'm currently at 7 centimeters femur lengthening, and I'm experiencing numbness in my right leg. I'm nervous it could be permanent if I keep going.
I think it definitely resolves itself over time. It took a while, but I think like after a year out, I think then I started touching my shins, and I got my senses back. But for some people, like I've heard it can like stay there for a few years. And I talked to Dr. Robbins about this too when I was going through like really bad nerve pain. He was like, we don't ever promise that this nerve pain won't be chronic, because like that's kind of like part of something you kind of have to accept as you're going through this journey. But the most important thing is like your motor function. So if you're able to still walk and run and sprint and do all those things you used to do before surgery. But as far as like the nerve, typically that will go away over time, hopefully.
Yeah. Nerve numbness, from what I know from the patients I've talked to, it does resolve after lengthening, within like 10 to 14 days, sometimes 21 days, when you stop tugging on it. Well, actually,
yeah, I mean, definitely the tingling and the burning definitely like went away.
That's what I meant. Yeah. But the numbness, it depends on how severe it is and how numb it is. It will definitely kind of slowly come back. Sometimes rapidly, sometimes slowly. Like mine, I had like at the fibular head, like I had a size like this, and then it got smaller and smaller and smaller to the point where I could feel more and more over time. I think it took like over a year. Probably closer, I can't even remember. Like, I think it was like closer to 2 to 3 years before it fully came back. So like Dr. Robbins said, it could be permanent. It could be moderate, or it could be pretty quickly that it comes back. All right. Users asking, hey, Victor, have you ever heard about a bone infection happening at a reputable clinic, which became osteomyelitis when a patient used an internal nail? Not with an internal nail. I mean, actually,
I heard like SideQuest had, I think he had like a diary on like the limb lengthening forums, but I thought he talked about he had some sort of like infection after like they did a re-break on his tibias. I don't remember. But
yeah. Was it maybe deep bone or was it surface level?
I don't remember. I would have to double check. But yeah.
Yeah, see, that's the thing with internal nails, it's very hard to get a deep bone, right? I mean, you can if there's like not good surgical technique or something's like, there's bacteria, but like, or if the patient just doesn't wait until their incisions heal and they do something crazy. But I have a hard time remembering if there was one case. I really feel like it was back in 2020, 2021 when I first started Cyborg for Life. I remember like one DM that came through and it was like an internal nail, but it wasn't like your typical precise or fit bone. It was like
was it like a mechanical nail?
It wasn't it may have been one of the mechanical nails. I don't think it was a mechanical nail like the Betts bone or the G nail. It was like this one nail that somebody else made, like a surgeon made, but it was I don't know, it was weird. And I didn't really pay too much attention to it because I didn't really know a whole lot about it back then because I was just starting to get into this stuff. But yeah, but like long story short, that was like maybe one case. Internal nails, once you close up, it's hard for bacteria to get in unless, like I said, your incisions are open. So, but no, not at a reputable clinic and not with a typical internal nail. No, I haven't really heard of that. External fixators, very common, much more common with osteomyelitis, but like very common with surface level skin infections. Alex is saying, what did Aaron do for dealing with his nerve pain?
Two things. Actually, maybe three. One is gabapentin. The moment you start feeling numb, like on your shins, just ask for gabapentin, and they'll definitely give it to you. And then usually you take like three pills of it. I think it was like 300 milligrams each, and then like the maximum you can take is like 6. That's one. The second thing is like ice. I think that's like the most effective thing you can do. I mean, I put that on the below, like just below my knee and on the front, and it took all the burning sensation away. I even like went to sleep with it, and it really helped because sometimes you would just wake up to like a burning like sensation for like 1 or 2 seconds, and then it just goes away. So I think that actually helped with that. The third one is just obviously like slowing down. I think helps, like just taking a break for a few days. So yeah, just those 3 things.
Yeah, I remember in your podcast you talked about the ice technique, and that was huge. That was really, really good. So a couple more questions here. Let's see here. Oh, we have another guest. We got Master Distractor on here with his funny name.
He's uploaded a lot of videos on YouTube, by the way, like his shorts. Yeah.
I saw his recent one about him touching the wall. He's consolidated to be able to weight bear. Congratulations, Master Distractor.
Yes, master about damn time. I'm full weight bear.
How long has it been for you to finally get to weight bear? How long has it been?
Too long.
Way too long. Put a time on it.
I think, but tibias, it wasn't that terrible.
Yeah.
So tibias, I did October last year, and I became full weight bearing about a month or less than a month ago. Maybe I think 3 weeks ago, 3 or 3.5 weeks, something like this. So that's for tibia, and femurs. I'm full weight bearing because I had nail exchange. So that's
got it. Yeah, that helped out.
Tibias came in a somewhat reasonable time frame, and they're doing like they turned out perfect, even though slow, but perfect. And also did a crap load of length. So if you go far, you gotta sacrifice some things, right? So, but yeah.
That's awesome, man. Very cool.
I think I came too late, but yeah.
No, you didn't. Yeah, you're here. We're just wrapping up the questions in here, and then we'll do a quick update and we'll wrap up. But yeah, man, that's awesome. Super happy for you to finally be weight bearing. Got all your length. Got now able to walk, and now you're going to start to recover. So that's huge. All right, so this one here is for Aaron. Aaron, are you expecting any changes in your athleticism, positive or negative, after a complete recovery from your Bowleg correction? Thanks.
Yeah, I mean, I used to be an avid runner, and when I did that, I didn't really notice any like stress on my knee per se. Like I'll probably get like shin splints, but I did hear a lot like when people are in their like 40s or 50s or 60s, like when they start like doing a lot of like jogging like over the years, their knee starts feeling a lot more of that stress. So hopefully this is also like a preventative measure, which is why I also did it. But it can only help. I mean, people get Bowleg correction for the sole purpose of like helping them restore function, right? So
yep,
it can only be positive.
Absolutely. So okay. To the top, is saying I was referring to the guy Aaron said went in the pool no matter what. Oh, for the David Goggins.
Oh, dude. Okay. He also got like DVT, and like he had some like a little bit of complications too. Like, and I would say like that guy has like the best positive attitude I've ever seen in any limb lengthening patient. I mean, I know him very well.
Wow.
But like I remember a story of like he got his like first nail on one leg. He had signs of embolism, and the first thing he said when he woke up was like, "When is my next surgery?" like he said it like with such enthusiasm, man. Like he's a different animal for sure, and I think he might consider doing tibias too.
Wow. So he's really in it for the long run. That's amazing.
Yep.
Very cool.
It's all about attitude in this game.
What'd you say?
It's all about attitude in this game, positive attitude.
That's right. That's 100% right.
It's a lot of challenge.
Absolutely. And a lot of resilience and a lot of waiting, but like you've hung in there and now you're finally weight bearing. That's awesome, brother. Pablo is saying at 0.84 starting tibia-to-femur ratio, I assume it's better to start with femurs, right? Yeah, that's
100%. Yes.
Yeah, that's shifting. Yeah, I would definitely do that if you're going to go for both. Definitely. Aaron, has your new height helped you pull any new hus?
So it's a funny question. I did have one girlfriend, but let me I can assure you that she knew me at my old height. So
Did
I
she?
would tend to say no. Yeah. So
Mhm.
technically, no.
Yeah. Once he heals up, he'll be styling and profiling.
But let's be just a little bit of disclaimer. Like I said, I didn't really expect to get any girls out of this, and I intend to stay single for quite a while. So I mean, not really much has changed, like even before or after, other than the fact that I'm just more at peace with myself, and I just don't think about my height anymore. That's
I
the only
like that.
thing.
I like
Yeah.
that. I think that's what it's mostly about, and that's huge, man.
I think it has to. I think it. Well, not has to. I think most people should be doing it for that. I don't know if you want to go for other reasons other than what Aaron said. Because I don't know. It's a long. Even if you know it's a pretty tough process. So I wouldn't just do it for random reasons.
Mm-hmm. Yeah, but I mean, not that the ROI won't come eventually, but it's like having your main reason is the core factor. That's huge. So, Impossible A123 saying, if I lengthen my femur a little between 4.5 centimeters and 7 centimeters, can it still be in the natural ratio? Yeah, definitely, depending on where you're starting from. I don't know what you're starting from. Yeah.
I mean, for the record, I'm at a 0.69 ratio, and by on the surface, by the numbers itself, the normal ratio is like 0.78 to 0.82. So yes, I'm not, but like if you look at me in person, like even I look myself in the mirror, if I'm standing up and I'm wearing clothes, like it's like it looks completely normal on the outside. So I mean, by the end of the day, I mean, I would say this, like I used to be very stressed about the numbers, but looking back, it's like numbers aren't really everything. So
yeah,
you can still look pretty proportional even with that amount of lengthening.
Absolutely. And we're going to play your video again at the end here.
I saw Aaron. I think he posted a video too. I think yesterday or something. And you can see him walking, and he looks very normal to me.
Yeah, that's what we played here earlier today on the stream. Yep. So, all right. Alex is saying, what are some workouts that Aaron is able to do without pain to help bringing back his leg muscles? So, what can you do, Aaron?
So back then, I think I did a couple like deep squats like over and over. I can probably do it with weights. I just didn't. I don't really go to the gym, so but I probably could change in the future. But I think deep squats definitely help with that. There was one exercise where like it's kind of like where you lay on your stomach, and you're also like you bend your legs and you're trying to like push it up towards like the ceiling. That also helps, with your getting your hip muscles back. Same thing like with and also going on your sides and doing those like side kicks up to the ceiling. I think those like
like
those really help. Clamshells. Yeah. Oh yeah, definitely those. Just for strengthening. There was also where there was like one therapist, Jessica. She calls this like over the rainbow, but it's basically where you're on your side, and you're just like you're kicking as far as you can to go like up and down, like, but you're also going like she sets like a tower of blocks, and you have to like go high enough not to kick it over. But I mean, anyways, like there's a bunch of things you can do to strengthen your muscles, and that's what I did.
Absolutely. And I mean, like you've seen in past videos of you, I mean, just sheer squatting and getting out there and running and stuff builds back your leg muscles and tone as well.
Yeah.
So that's for sure.
And once you're weight bearing, like just walk as much as you can. I think that like a lot of people struggle to get their gait back in the beginning. So I mean, once you're able to walk, just the only way you get better at it is just to do it.
Absolutely. Specificity. Aaron, post lengthening, are both of your thighs symmetrical in diameter, size, or is one thigh slightly smaller than the other? The size of my numb leg is smaller than my right leg. My other leg.
That's the first question. I mean, I never really noticed my diameter, not one to measure, but they look perfectly fine to me. I mean, like equally. So yeah,
it's interesting. That is really interesting. I wonder if something's going on with his numb leg. If it's a little bit, his numb leg's smaller. That is interesting. Maybe a muscle innervation issue. User is saying, I'm in the process of getting tibia PMAX surgery nail done in January 2027. Should I get peroneal nerve release? I don't like the idea of someone touching soft tissues, but I don't know what the risks are if I don't get peroneal nerve release. Yeah, so actually Dr. Robbins, like when we had him on earlier this month, he said that he doesn't do it for tibial lengthening, which is really surprising to me because I got it done prophylactically, which is a preventative measure in the actual surgery. But he said that he doesn't like to do it unless it's absolutely necessary. So I guess it's going to be dependent on which surgeon you're going to and what their protocol is. But for me personally, I had it done in surgery because I had big calf muscles, so it made sense. But I guess for the vast majority of people, they don't get that compressive, that compression at that fibular head. So they may not need to get the decompression, the nerve release. So it's a good thing to bring up with your surgeon when you're having a consultation with them. You may not have to get it done. Look, if you don't have big calf muscles, maybe you don't have to get it done. So it's a good question to ask.
I didn't get it.
You didn't?
No,
yeah, but look at your calves. I'm just kidding.
Well, not just me. Like that's true. But all the other.
I'm playing.
The other patients I know at Dr. G's place, most I don't think they get it either. I can't speak for all of them, but I don't think they do.
Yeah. I don't think there's nothing wrong with my calf or like my muscle. Like look at what I do. I run every day. I work out every day, like a very high level. So it's like getting it done or versus not getting it done. There's really no difference. I don't think. I think that's just up to the surgeon how they feel comfortable. They don't want to run into complications based on what they see when they start with you. So for me, big calf muscle going in, Dr. Conway is like, you know what? I'm going to take this preventative measure with you. I don't want any issues. I was like, let's do it. So, all right. Alex is back with another question saying, what's the timeline for other clinics in the US to get the new nail? I live in Vegas, but the last resort, I could get the surgery done in Florida, then find a good PT place in Vegas. Yeah. So I don't know the exact.
July 29th, right?
What's that?
I heard it's like July 29th.
I actually heard it differently. I heard it be in August for other clinics. Okay. From a patient who said that he consulted with the Paley people. They said that the rollout's going to be like in August for other clinics. So because they said that they so it'd be like next week. It'll probably start going to other clinics. So sometime in August. So I don't know, Alex Smith. So yeah, it just depends on who you want to go to. If you're doing femur lengthening, flip of a coin. If you're doing tibia lengthening, pick wisely. If you know what I'm saying. Invincible Summer. Aaron, are you worried that your 0.69 tibia to femur ratio will have negative consequences for time over time? I know you look completely fine. I'm talking about biomechanics.
Yeah, I think the only thing is just like when you're squatting, you're just having to lean forward a little bit more, and that is something I've noticed. Like I will admit, at this moment, it doesn't really bother me. So other than that, not really.
Yeah, got it. Okay.
I don't really do compete for I don't really do deep squats. I don't even squat with weights at the gym anyway, so it doesn't really affect me that much. But if you're doing competitive dead weights or whatnot, then that might be concerning. Be a concern to you, but it doesn't bother me.
Yeah, but you were doing deep squats in that video that you were out and about. You showed us the video. I mean, you were.
Oh yeah, in the Asian squats. Yeah, I mean those squats, definitely. Yeah.
Yeah, you can get down deep. Yeah. So you have very good natural flexibility, which is rare. A lot of people have to work for it, but you have good flexibility. All right, so that's there. We just topped out on those questions. So what I'm gonna do, I'm gonna show Aaron's video again. I want to talk to MD about how he's doing with his recovery. We'll wrap up with Aaron. If there's any other questions, you guys can put them in the chat. We'll do one last lap in a second before we close out the show. But all right, so this is the video that Aaron shared at the beginning. If you want to go back and see his actual x-rays and stuff, just rewind to the beginning of the video. But here's Aaron about a month after he was just playing, but a month after his tibial Bowleg correction, walking perfectly normally, straight tibias after his femur lengthening. It's 14 months after his femur lengthening surgery. So this guy's fully recovered and he's back to, he's still kind of using crutch on the stairs?
Yeah, if I'm going if I'm going outside of my room, then and going downstairs, then yeah, I'll use the crutches. If I'm going out, obviously I'll use the crutches. But if I'm just like in my bedroom, then I don't really see a need for it.
Yeah. Yeah,
So,
that's
I mean, like
incredible, man.
like here's the thing, like Dr. Paley said, like you can put as much weight on it as long as you're using like crutches. But I mean, that implies like it's really mostly for like stability purposes. He has like he has like high confidence that the weight shouldn't be like backing out, and it shouldn't be then enough stress to kind of like make the plates or the screws kind of like back out. So, and plus like they check for that too. So
that's cool. And when's your next checkup?
Like my next X-ray, I think is like August 17th. I think that should be a Monday, maybe like 3 weeks out from now. But yeah.
Okay, and you just send the X-rays to them, let them look at it.
Yeah.
Okay, very cool. All right, last question. Sorry, Emily, go ahead.
He looks great.
Yeah, he does, man. He's just walking around super normally. I mean, this guy heals like. If he could just like sell his recovery to everybody, I mean, he'd be having his own business. He wouldn't need to go, you know, on a career. He'd have a career.
He's famous too. He's more famous than you was, so.
Absolutely.
Oh no, he left.
No. I pressed hide on him by accident. I meant to hide the video.
He's so famous, he just left us. No.
All right. So MD, so what's your recovery like, man? You're walking now, so talk about that real quick.
Can I show you?
Sure. Go ahead. Yeah, you can show us.
No, it's on. I don't have it ready. It's on my videos.
Oh, okay. Okay. Can you put the link in the chat, because I gotta pull it up because I don't have the link right now.
Okay.
I can go to Discord, I guess. Let me see if I can go to the Discord.
No, you just go to YouTube and look up Master Distractor, and it'll be
okay. Let me pull that up here.
Sorry, I
gotta dip out real quick, but yeah, it was a good show.
What's that?
I gotta dip out real quick, but it's a good show.
Got it. All right, Aaron. Thanks so much for joining.
Yeah, for sure.
I put a bunch, so I'll just like maybe show a few.
Yeah, let me get that one. We'll do that, and then we'll wrap up. Let me get just trying to find it. Hold on, I gotta search it.
If you go to,
here we go.
Yeah, and then go to my channel, and then go to Shorts tab.
Okay, so go to Shorts tab.
Yeah, and then I can show you which one.
Okay, and then which is it the newest one or the?
No. Are you able to see it right now? Are you able to see the screen right now? Or you could only play at the video. Sorry, I'm at my computer.
No, I'm trying to pull it up.
Let me get on the computer today. If not, if you show me the screen, I can show you.
Okay. Let me share my screen. I got you guys. I see what you're saying. All right, share screen. Master Distractor. Share. Can you see?
Okay, there we go. Yeah, I put a bunch up. So I have one. Maybe there's something nice to show is the proportion. And if you go scroll down,
these are older though, right?
These are all I posted like a few days ago. I just went on a spree. So maybe if we do like the go down to the third row, and then you see on the red shirt on the third row. Put that one. So let's see, like show that one and maybe another one.
Hi, my name is Dylan. Crap. What happened? Right one?
No.
I'm 5'10".
No, it went. I think you're scrolling too much.
I scrolled by.
The short. Yeah. There we go. And let's stay there. We go.
Can you see it?
Yep.
Okay.
It's copying my style. Can I give you something else to balance myself? That's me showing off.
Wow, man. Long arms. Tall height.
Using the ceiling to balance myself. After 13 months of distraction, now full weight bearing recently. Oh yeah, I can use the ceiling like this to balance myself. Can use the wall.
Incredible. How many days
Don't
after?
look like Aaron.
2 weeks. 2 weeks.
Huh?
2 weeks post full consolidation. Oh, okay.
2 weeks after I got clearance to weight bear.
Oh, okay.
Yeah, I got cleared like 3 weeks and something before. So I'm not consolidation, just a full weight bearing clearance.
Yeah, I can use the cane a little bit faster.
I'm still using cane and walking stupidly to waddle, but still trying to walk as much as I can.
And then
maybe we can go back to the other tab. And then
the videos tab or the
yeah, no, this one. Maybe let's look at my. I don't know. Maybe you should see my proportions because I don't know. People are
Sure.
very into proportions. If that's the first video with me in like a striped shirt, the
This
first
one here?
row.
right here?
No, in the first row. In
Oh,
the first row, the striped shirt. Yeah.
This
First
one?
row.
Oh, the
No,
first row.
first
Yeah.
row.
Oh,
Yeah.
got it. Here,
And-
got it.
Striped shirt. There we go. It's very close. It's not showing. I don't know. Oh, there we go. There we go. It's good. That's good. That's good.
Oh, okay.
So, that's it. This is short. That's the
Good, man. Look
proportion.
at your arms. Yeah, that's great. And so you bring it down to the side. Yeah, because you can't see your legs in this image, but you can see like your
No,
arm
no.
length.
My point was I got too tall for the mirror. So
Oh, got
This
it.
is this is
Yeah,
just me enjoying because I don't go outside, so it's just me enjoying what I have
that's awesome.
until I'm able to, I feel it's more safer to go outside.
Right.
Yeah, and then I have one more video of me walking, but it's basically crap like this on my channel,
No,
just
it's
trying
great.
to.
I
yeah.
highly recommend people come check out his videos. You guys want to see
It's
some,
just maybe for entertainment. I put the
Entertainment.
diary too there. Diary
there's
as
your
well.
diary?
I don't know the
Yeah, the
diary.
Discord diary.
Yeah, it's just like
Yeah.
a preview. Yeah, preview. And other random things like that you see me on the gown. That's actually right after tibia post-op on the
okay.
first row.
Yeah.
That's me screaming in pain.
Oh,
Giving a
really?
shout out to Aaron before he left.
Oh,
Not,
yeah,
you know,
yeah.
yeah.
I remember that
It was,
time.
it was last year, and so it was. I remember that video quite well. And my physio was like, "Keep talking, because it helps you like loosen up." So that was the second day after surgery, in the hospital getting physio.
Yeah, you got a lot of videos here,
maybe-
guys. Go check out his channel. It's called Master Distractor on YouTube. If you type it in, you can go check out his channel, subscribe, and then check out his videos if you want to see some more insight into
If
a
you want to see
quadrilateral
me,
lengthening
just
patient.
this one I put. Go up to the first row again,
Yep.
and the third one with the power stool. Click on that,
Okay.
and that I'm literally just point of view, just walking like without
Okay.
anything now. So that's just
Oh.
yeah.
Oh, I turned on the sound.
I shot that. There's not much sound. I just shot it like a couple of days ago,
Oh, okay.
so that's me holding the camera because I don't have much of
Okay.
people to film me. So. But that's my
This is
crutches.
regular crutch. My short crutch used for balance.
And I think that's your height, Victor. The short crutch.
Yep, that is. Until I get lengthened,
So I
then I'll
use
be
the
6
top.
foot.
I used to use the top of that to balance, like the top of the crutch, because I'm not allowed to, no longer able to hold on. Not supposed to weight bear anymore.
Oh, okay.
That's all the pencil crayon scratchings of my height.
Oh, wow.
19 years. That's 19 years of dysphoria right here. Pain, back pain. Starting out here, my heel height in various heels or lifts, and now around here. This is the power of this surgery, right there.
It's awesome. Very cool. So what are you doing in terms of recovery right now, in terms of like rehab, physio?
Just walking a lot because that was what I was instructed to do. Full weight bearing, and then do stairs.
Okay.
But I don't really have I have like a big staircase, like how Real was going up and down stairs. I can't really do that because I'm scared.
Right.
So I have like one step. I just really load in one leg. And even that, I don't know if you saw that vibration plate thing. I just step onto that and just really activate everything. And just it's not on that video, but another one.
Oh, okay.
But I step on that and I just like use it like a maybe if you go to the on the side and the well, that's just me shaking.
Oh, this is not.
I use that too.
Okay.
No, you can see it if you want. It's
Which
on
one
the
is it?
second row.
Yeah.
Second row last video with me on a cane. Yeah.
This one. Okay.
Yeah. So this I don't know the
Let's
sound.
see. Oh, sound. Yeah, there we go.
Maybe go to the end.
Go to the end. Okay.
Yeah, it's just like me
Oh,
using
here it is.
various.
Yeah.
I just step onto that. Like use it as a step, or any step really, right? Go and then try to like go up and keep doing that over and over again, without putting load on my on my hands. Just put the load directly on the leg, and that's like I know it's simple for regular people, but at this stage, since my quads are quite weak because it's been so long, it's a lot of effort. Like it's a lot of effort to do that. But after I've kept doing that, like really loading my like leg and trying to like just step up using my leg only, that seemed to have developed more muscle. Like that's I mean, doing that and then standing on the vibration plate, just walking. I'm trying to just trying to balance myself. All of this stuff is taking quite a bit of time, but that's mainly my rehab.
You just got
right
cleared
now.
though. I mean, that's great.
And
I think you're doing it the right way. Yeah, squats, walking, strengthening the VMO, the vastus lateralis. Like if you just get back to just movement and just basic functional tasks, you'll rebuild. It's just going to take time. You just got cleared not that long ago, right? A couple weeks?
No, it's like 3 weeks and something.
Yeah, that's nothing. Yeah, give it 6 to 8 weeks. Watch what happens. You'll be transformed. So that's great.
Yeah.
Awesome stuff. All right, so let's see if there's any more questions. Then we're going to probably wrap up here.
Just want to say hi to you guys. Is that all right?
Hey, what's up, Zach? How are you, man?
Yeah, I just finished making Italian food, so I didn't get a chance.
Oh, nice.
I just want to ask MD a question. What height are you right now?
I like to be annoying on purpose, and I don't say because I want Victor to come meet me and measure me.
Okay. Fair enough.
So I can tell you the range, but you can see from my videos. You can try to guess.
I'm gonna look.
What do you think? How tall do you think I am? And also, I don't know. I just like messing with people with this.
That's
but
right.
I can tell you.
Height.
That's awesome.
I can definitely tell you. I'm over 6 foot, but I'm not. I'm under 6'5", over 6 foot. So you guys can figure it out.
I got it.
There you go. Some in that range. That's perfect. All right, let's see here. So if you get, let's say 3 inches limb lengthening, and you'll never be able to fight and do sports the same. So it's going to be different. What's the point of your athletic abilities and movement won't be the same? So you have to adapt and you have to adjust if you get 3 inches. So it depends on the sport. Like if it's a sport that you're currently competing in, you shouldn't do this before that you finish that, right? So the sports take priority. This is specifically for height gain, and you can get back to functionality and do a lot of things you like to do. But if you're at like a pro competitive level, definitely don't do this. I think you'll be back to normal after 1.5 years. Yeah. What's that?
Can I quickly add on to that? What he was saying with the athletic ability. I think I just maybe try to echo. I just because I listen to all your surgeon interviews or even most of your stuff, like Burke to Burkholz and Dr. Robbins. They're saying, I mean, if you would it matter if you after you do this surgery, like it depends how important this is to you. Would it matter to you at the end if you run like 30 seconds or 1 minute slower? It's something along those. I can't exactly quote what they said, but they said something like that. So if you're going into it at this mentality, I need perfect athletic ability, which is great. Maybe that's what you want, but is that, do you really want to do this surgery in the first place? Is what I'm trying to get. Because I think the thing is, you shouldn't be doing this for these are maybe superficial reasons, but it depends how much this bothers you. And if it's not really bothering you enough, even though I feel like I don't want to recommend the surgery for random people. I really don't think it's for that purpose. That's something I want to get out. I don't think this is, even with Precise Max, I don't think this is just for everyone. I really don't. I agree.
I think for those patients who are a little worried, like I'm looking at this next question here for he was responding.
Yeah.
What's that?
I'm sure you'll get it back, but like I don't know how, like, if maybe you'll get it back 99%. If you lose that 1%, how much does it bother you? So that's
and the thing is
point.
that we have to understand that limb lengthening, you'll lose different percentage points for different athletic abilities, right? So for my sport of bodybuilding, obviously I got like the discrepancy fixed, but like there's still a segmental discrepancy that I have. My knee heights are not the same, even though my hip height is. But the thing is that I can still perform for my sport. But if I were to go do soccer right now, I don't know. Maybe I did drop down 10%, right? I don't know. I won't know for sure, but I can bet you that I was able to do sprints and stuff. But then again, I'm so much older. I'm over a decade older than I was when I had limb lengthening. But let's say that you do femurs 8 centimeters. That's going to be a drastic change to your biomechanics. So there's going to be an adjustment period, and you're going to be playing differently if you're doing a certain sport. But that goes for lifting. It goes for like running, sprinting, jumping, soccer, basketball. There's certain adjustments for every type of athletic activity that you're doing. So you're not. So maybe there's it's like maybe there's a 5% decrease in like basketball, or there's a 7% decrease in soccer, or there's a, I'd say a 6% decrease in pickleball, right? Because of the nimble agility that you have to have. So there's different percentages that you're probably going to have to make up for. But maybe you recover so well that you don't lose a whole lot. But anybody who's getting this done or planning to get this done, my advice to you, if you want to have a really good athletic recovery on the back end, go conservative, right? That's how you can have almost like a foolproof plan that you're going to be okay and you're going to be able to recover really, really well. And what does that look like? I think for the femurs, it's between 5 and 6.5 centimeters, maybe up to 7 centimeters for some people. And then for the tibias, I think that's like 3.5 to 4.5, maybe 5 with the PMAX if you can keep the tissues really flexible. If you go over that, then you are probably going to just do this for height, and there's going to be some decline in decrease in athleticism. That's my belief. That's my opinion, and I'm putting it out there. So, but anyway, let's keep moving. We have a few more questions. If there's a solid chance, he already said that. Maybe I'll wait until the technology gets better. Man, I don't know how much better it's going to get for a while, but I have some thoughts. Cyborg now, 2027. I'm just kidding. No. But I do think that, like I said earlier, go conservative if you have any worries or fears or doubts, because the conservative patients that I've talked to who've done like 7 centimeters and below, they've recovered phenomenally well. 8 centimeters do too, but I think that they have to have a longer recovery timeline and a bigger adjustment period. So, does this surgery leave crazy scars? MD, can you answer that one?
Not really. It will leave scars though. So I would. It's for the entry point where the nail is inserted on the femurs. You will have a scar near your butt area or the side of your butt area, and that it is noticeable. I don't know how you can not notice it if you don't take your underwear off. For your knee, for your tibias, there will be an entry point. This is for internals, by the way. You'll have I can maybe I can show you later, but you can see right where the kneecap is, or right above the kneecap, around there. You'll have like a 2 to 3 centimeter little scar, not like a entry looking hole. So you'll see that. Everything else though, is very, very hard to see. I could barely see any of the other scars, and for tibias, there's a lot of holes. I was gonna, maybe next time I'll show you my surgery, like the actual footage of my surgery, and you can see Dr. G just drilling into me in various places, and there's a bunch of holes, and I woke up with like, I don't know how many holes, maybe it's like, I think 22 holes or something, 22 holes altogether in your tibias, and now I can't see any of it except the entry point.
Yeah.
And it's been October, so it hasn't even been that long, right? It's not even been a year. So the entry point scars, you will probably notice. You can probably, I use something like scar tape now because I had the nail exchange, and those scars I can still see. So I'm using scar tape. But yeah, maybe I ran wrong. But you will see them. But it's not noticeable though.
That's true. That's true. Alrighty. Oh man, thank you so much, Precise Max. Appreciate it. Thank you for streaming, and then you sent in another one, man. I really appreciate this. You're helping out the brand. Because I think your guests are trying to gatekeep this procedure. LL for all manless. That's true. All right, so we're gonna wrap up here.
Talking
Last
about me.
Yeah, exactly. Yeah,
I'm trying to gatekeep it. Yeah.
You're trying to
I'm not
gatekeep
trying to
it.
gatekeep it. I'm trying to gatekeep it from the people that, you know, I don't want anyone to regret this after, you know. Most people don't. I don't think like
Most people
what is like a
don't. They
90
really
to
don't.
yeah, not as long as they had a good without complications.
I bet you if I grabbed somebody off the street and they were just a normal person, I gave them limb lengthening and just coached them through it the entire process, they'd probably be happier on the other end too. Like, it's like, who wouldn't be happier, taller, and like, you know, whatever it is. Now, the downtime, you know, away from the world and stuff, that does suck. But like, if you get through it and you get back on the other side and you pop back into the world and you're back to normal, like, there's really not much to regret if you do this right. If you get a complication, there's a ton to regret. But anyway,
I just want to ask you one more question to MD.
Sure. Yeah.
I'm sorry, Vic.
Yeah, go ahead.
So, did you feel like once you got this done, did that light switch off? Do you feel like a big difference now in the height that you finally achieved? You do, right?
Oh, 100%. Like this
right.
is. I like this procedure. To me, I call it a miracle surgery, and I've been calling it a miracle surgery ever since I've seen it, like 20 years ago.
I agree.
And for me, definitely, it's for the right person, this is a miracle. Like, I cannot stress that enough. But I have talked to, like, since I've been in this for so long now, I talk to so many patients everywhere. Not as much as Victor, obviously, but because I just meet patients because I've been in it, like, you know, in Montreal, just randomly running into patients all over the place or whatever from Discord or YouTube. And I actually like randomly had a phone call from someone, like, I think he talked to you too, Victor. I hope he didn't mind me sharing this, but we're not sharing any identifying information. I think he had it for the wrong reason. He actually talked to my surgeon, and my surgeon was like, maybe you should wait. Like, some people are doing this for wrong reasons. You talk to you too, Victor, and you actually you get him my number, and I talked to him too. And I felt like after the first, like, you know, 3 minutes of talking to him, I can just tell this guy is doing it for the wrong reasons. And I don't think this is for you. Like, this is not something you want to just do. But if you do it and you're the right person, and a lot of people are who's actually in this, you know, watching this stuff, it's a miracle. Like, it is life-changing. It is and I haven't even experienced anything. I'm like, you can see my videos, I'm not even going outside. I'm basically just touching ceilings and looking at the mirror, and that's how happy I am. I have not gone outside. I'm barely walking still. I can't even sit down right now because my muscles are weak, but I'm fucking stoked. And I only seen like 2 friends. I have yet to even experience the full benefits, right? So just seeing that wall of me, that wall where I was putting that pencil crayon mark, just being above that after 20 years, that is like so magical. So for the right person, it is 100% mind-blowing, amazing. And I have yet to experience this in social situations at all. So
wow, yeah, that's so powerful. I think that you really did have a real serious case of height dysphoria, and now it seems like it's completely notched down and it's like turned off. That's incredible, MD. I'm so happy for you, man. It's really, really am. I think a lot of patients, they have different degrees of it, and but I think they always have it, right? Like, that's what they want to turn off. And they just want to stop thinking about their height. So powerful. I love that. Good stuff.
Not everybody gets and understands that.
I want to ask you a question. He says,
I agree.
7 centimeters safe on femur. It can be. Yes, it can definitely be. Love the stream. Keep going. Thank you so much. Won't be here next week, but we'll be here back the week after. Alex Wong is saying, hope more clinics get the max nails soon. Gonna get a surgery when it's available in, what's PNW?
I have no idea.
Yeah, I don't know. Something part of the world.
Geography, Jack. I don't know.
I don't know. It's probably something that I know. I'm just not thinking something. Yeah. Anyway,
Papua New Guinea. No, I don't know.
Let's see here. To be honest, 6 foot. Okay, they're talking amongst themselves, just trying to get everybody's question in. Precise Max, he says, pay to play.
Man, so
It's a
much
privilege
money
to
for
get
you,
your
man.
questions. I know. He says it's a privilege to get your questions answered. Vic, from now on, people got to cough up money. You do so much for free. Thank you. That's right. If you
True.
want to ask
That's
questions,
true.
you got to pay for it. No, I'm just kidding. I appreciate that.
I would pay
Precise
you
Max.
if I
really
didn't
do.
spend. I would pay you if I didn't spend all my money on 3 surgeries.
No, you're good. You're good. You're paying by coming on
Yeah.
here and sharing your experience. It helps other patients. So I appreciate that. Thank you, Precise Max. Thank you all for joining today. Let me see if there's any last questions that need to be answered. The Rick friend, limb lengthening is only worth it if you're in the 5'8" to 5 to 5'8" mark. Okay, well that's your opinion, and I think that it can be worth it for a lot of people.
Yeah.
They're talking amongst. Oh, he said Pacific Northwest. Got it. Thank you, Invincible Soda, for the clarification. Makes sense. I failed geography, so okay. That's it. I think we got it all. Guys, that was an amazing show. I want to give a huge
I'm
shout
sorry,
out to
Victor. I don't want to bother you. I have just one more thing I wanted to ask about.
Sure. Go ahead.
Yeah, I want to keep it brief. Don't worry, man. I'm going to be gone
Yeah.
soon. I want to. The thing about the quadrilateral lengthening and the PMAX, can that be done simultaneously? Because I was hearing about that.
It can be.
So
Yep.
with the PMAX, you can do the femurs and the tibias
Yes.
in like
yes,
3
you do
weeks
it.
apart. So
Yep. There's a patient that's getting his second surgery with the PMAX probably next week.
quadrilateral. Wow.
Yeah.
Okay. All right. I mean, that's something I might look into, but I mean, I got some saving already. I'm working on it. So
That's awesome, man. I'm so happy for it. I know you've been working at it for a long time. But
it's gonna take time. I know it's been taking like a year, but
hey, however long it takes, it took Master Distractor 20 years, right? Master Distractor.
Yeah.
That's
I mean, I've been
20
wanting
years.
this-
That's 2 decades.
I've been wanting this for 30 years, so it's like. But no,
Yeah.
I
A lot
agree.
of, it's a lot of money.
Devin,
But I wouldn't recommend
Devin,
the quad though.
I
3 weeks.
agree.
I mean, in my experience, I don't recommend doing 3 weeks. Like that seems.
Yeah.
I don't. I just remember like. I don't know. I just don't recommend it. It's great if you are gonna do it. I in my personal journey, I don't think I'm gonna handle it. So.
Yeah, that's true.
I'm impressed with you, man. Great job.
Yeah, man. If you want to reach out, just shoot me an email, victor@cyborgflife.com, or you can go to my website, cyborgflife.com, the contact tab. Reach out that way. I usually check emails. I got quite a bit of emails to check through, but I'll do them tomorrow or Saturday. So I'll try to respond. Or if you want to book a consultation and do that as well, it's on there. So feel free. All right, guys. I'm going to wrap up because I have to get some dinner, feed the dog, get ready for bed. Your boy wakes up early in the morning to train. So really appreciate you guys in the chat asking amazing questions. Always appreciate your engagement. This is helping limb lengthening become more, spread limb lengthening awareness. That's what we're trying to do here at Cyborg for Life. Thank you, Aaron, for coming on and sharing your recovery updates. And I'm so glad you're doing well. MD, congratulations on full weight bearing. Keep us posted on your recovery. And guys, go follow him, Master Distractor, on YouTube. If you want to follow his diary and Discord, it's there as well. And yeah, Zach, thanks so much for joining as well, asking some questions. And won't be here next week, but we'll be back in 2 weeks from now for the next episode of Limb Lengthening Live. And for episode 206 of Limb Lengthening Live, this is Victor.
Subscribe to Victor, man.
Master Distractor. What's that?
Everyone subscribe to Victor. Subscribe to Victor, man.
Like and subscribe to Victor.
Guy's amazing.
Yeah.
He's really gotten me help for this. I mean,
and he's also very lean and good looking now.
Yeah, that's right. I lost all the chub on my face, right? I'm probably down to like 5% body fat right now, dying. I want to eat. So, but no.
Awesome.
Thank you guys so much. I really appreciate you. Yeah.
Give him money for food. He's very hungry.
Yeah, exactly. Thanks to Precise Max, I can finally eat, right? Thank you guys. Appreciate it. All right. We'll see you in 2 weeks. Everybody, have a great night. Until next time, Victor from Cyborg for Life, signing out. Have a good night. Peace.
Mm-hmm.